The weather has turned colder. We're thinking more about the cold and flu season, and experts say now is the time to get a flu shot. Dr. Ronald Charles with Buckeye Health Plan is here to explain why. Good morning. Thanks for being here today.
Good morning.
So first of all, let's talk about the flu. I think some people might think they have the flu sometimes, but maybe it's not the flu. Maybe it's just a cold. What exactly are those symptoms? How will someone know I have the flu?
The flu is caused by a virus called the influenza virus. There's two types, influenza A, influenza B. Most commonly, you find influenza A causing the flu. And some of the symptoms, they're really kind of constitutional, but fever, body aches, chills, headache. Those are some of the classic symptoms for the flu.
Okay, maybe that fever might be something that really kind of signals something's really not great here.
Exactly.
Yeah.
Yes.
So why is it so important for people to get the flu shot, and why do they need to get it now? Why this early?
It's important for your health and also for the health of those around you. When you get a flu shot, what it does is it creates immunity to the virus, and so you may still get the flu because now the flu vaccine that you get may be from a previous year, but it still is going to be effective because the major parts of that flu virus does not change. And so it's important to get it because it helps to decrease your chances of getting full-blown flu and maybe having to be hospitalized. It also helps to prevent your family members and those around you from getting the flu.
You don't want to spread it to everybody else,
no,
right?
That's correct.
Right. So who needs to get the flu shot? Who can? Is there anybody who shouldn't get it?
The flu shot should be given to anyone age 6 months and older.
Okay.
And the reason why that's important is because for example, babies less than 6 months old, their immune system is just getting revved up, so they do not have the ability to make antibodies until about 6 months of age.
Okay.
So they're living off of what we call passive immunity of their mothers.
And so, but pregnant women can get a flu shot.
Oh, absolutely. That's one of the highly recommended groups that pregnant women get it for that very reason, because their immune system, pregnancy causes an alteration of your immune system, so it makes you more susceptible to certain infections and disease processes.
So the vaccine, though, kind of has to change every year, right?
Yes.
Yeah, and so they kind of try to, is it a guessing game here to try to figure out what the right
they kind of look at, well, what has been the pattern of the different flu viruses over the past several years, and then so they utilize that to anticipate what things, what type of dead killed viruses that they need to use in the flu virus.
So the vaccine is, fairly effective. We're talking about 40 to 60% or something like that?
Yes, that's absolutely correct.
But even if you do get the flu, maybe if you got your shot, you might not get as sick?
Exactly. You won't have the same symptoms. It won't make you as ill. That's why it's so important. And it also protects those around you so that they won't get ill.
Right. So that's why even if you do get a little sick, it's better that you have the shot anyway.
Absolutely.
Because it could have been worse if you didn't get it, right?
Absolutely. And you also have to worry about there's some secondary infections that can occur when you get the flu. For example, one of the secondary complications is pneumonia. Okay. So you can become more susceptible to pneumonia from some particular types of bacteria if you develop the flu.
And last year we had a pretty harsh cold and flu season last year. So
we had a really bad flu season last year.
Yeah, so we want to make sure everybody's getting protected now. Get that shot
Absolutely.
now. And the flu mist is the nasal spray back this year.
Yes, it is, and it is a live. It's a live vaccine, and it's recommended for people between the ages of 2 and 49.
Okay, and is that for folks who maybe they just don't like getting a shot?
Yeah, it's an alternative.
Okay.
But it's important that you be within the parameters for that, yes.
Okay, very good. All right, well, and most insurances will cover a flu shot, so if there's ever a question about people, maybe I can't afford to get it, chances are it's going to be
Yes,
covered.
most insurance companies cover the flu. We at Buckeye Health Plan, we cover flu shots, for be it at your physician's office or at one of the retail pharmacies.
Wonderful. Well, thank you so much for coming in today. We appreciate it.
Well,
Hopefully you
thank
stay
you.
well this cold and flu
I'm
season.
planning on getting my flu shot.
Very good. I got mine already, so there we go.